At first, this is the bone of the sacrum. The smooth pelvic surface is directed forwards and downwards, and rough dorsal surface is directed backwards and upwards. And the upper surface of the body of the first sacral vertebra slopes forwards at an angle of about 30 degrees, and the upper end of the sacral canal is directed almost upwards and slightly backwards. Now it has four parts: base, apex, four surfaces: pelvic surface, dorsal surface, and right and left lateral surface, and the sacral canal. In the pelvic surface, here present the sacral promontory, ala of sacrum. Here ala of sacrum, it has two parts: medial smooth part and lateral rough part, and these are the transverse ridges. There are four transverse ridges present that fuse five sacral vertebrae to form a sacrum, and here presents anterior or pelvic sacral foramina, and this one is inferior lateral angle of the sacrum of anterior side. In the posterior surface, here present superior articular process, here present medial sacral crest, intermediate sacral crest, and lateral sacral crest. And this one is the sacral hiatus, U-shaped sacral hiatus, and these are sacral cornu. And in the lateral surface, here present auricular surface, and it articulates with the bone of the ilium. Contents of the medial smooth part of the ala of the sacrum from lateral to medial side: obturator nerve, iliolumbar artery, lumbosacral trunk, and sympathetic trunk. And in the median line, here present median sacral artery, and here present sympathetic trunk of the both side of median sacral artery, and here present ventral rami of sacral nerve. Now the contents of sacral canal. These are lower part of cauda equina, phylum terminale, spinal meninges, and lateral sacral vessels. And structures emerging the sacral hiatus are fifth sacral nerve, coccygeal nerve, and phylum terminalis. 6 types of joints are present in the sacrum. Here lumbosacral joint. There are two types of lumbosacral joint between the vertebral body. This one is intervertebral joint and secondary cartilaginous joint, and between the articular processes, superior articular process of sacrum and inferior articular process of lumbar 5 vertebra, zygopophaseal joint. These are plain type of synovial joint. And here present intervertebral joints. These are primary cartilaginous joint because these are fused to form the sacrum. This one is sacrococcygeal joint, and this is secondary cartilaginous joint. Here present iliosacral joint. Here present two parts: anterior smooth part and posterior rough part. In anterior smooth part there is plain type of synovial joint, and posterior rough part there is syndesmosis type of fibrous joint. Now the muscles are in the lateral rough part of ala of the sacrum. Here attached iliacus muscle, and here present capital E-shaped piriformis muscle. In the inferior lateral angle of the anterior surface, here present coccygeus muscle. In the posterior surface, here also present three types of muscle. Here present multifidus muscle, and multifidus muscle is covered by the erector spinae muscle. And in the inferior lateral angle of the posterior surface, here present gluteus maximus muscle. Here present two terms, sacralization and lumbarization. Sacralization is when lumbar 5 vertebra fuse with the sacrum is called sacralization, and lumbarization when sacrum fuse with the lumbar 5 vertebra is called lumbarization.